It's probably the most significant threat we've had since the start of the pandemic. And I'm sure, for example, that the numbers that we see on data over the next few days will be quite staggering compared to the rate of growth that we've seen in cases for previous variants. The real potential risk here, and I would underline that because we are still learning a lot about the variant, is in relation to its severity, clinical severity, and therefore whether those cases turn into severe disease, hospitalisations and deaths. And we are still at too early a stage for that. In fact, the world probably is still at too early a stage to be clear. The difficulty is that the growth of this virus, so it has a doubling days at the moment, which is shortening, i.e. it's doubling faster, growing faster, and in most regions in the UK is now under 2 days. When it started, we were estimating about 4 or 5. So if you think of that growth rate right across the UK, and we're starting to see it and feel it now in London particularly, but yesterday particularly around Manchester, and we're very sure there are levels growing across most communities in the UK now, although there is quite a lot of regional variation still. The real risk issue is that we can see that there are so many unusual mutations on this virus that it runs the risk of evading our natural and/or vaccine immunity. And we have early studies looking at immune serum from patients who've been ill and been vaccinated to see that 2 doses of vaccine against symptomatic infection, so we don't know yet about severe disease, but about symptomatic infection is much reduced. We do know that the booster dose will push that right back up, but it still comes back to a level below that we've had with the booster effect for Delta, our previous wave. And so this is highly significant because the numbers of individuals who are potentially involved with this and a small degree of vaccine or immune evasion could have very significant impact on our health services.